Well,
Kevin Blackwell's in the house. Good morning, sir. How are you? Senator Blackwell, District 19, DeSoto County, Marshall County's Chairperson of Senate Medicaid Committee. How's it going, sir?
it's going real well.
You haven't won the lottery lately, have you?
Not lately.
And I say that just to squeeze this in. The COVID count from Friday, Saturday, and Sunday was 796. Again, that's a 3-day, and that averages out to what, about 260, 265, somewhere in that area. 2 deaths. Mississippi Cash 3 overnight, $500 jackpot. The numbers were...
000.
No, but you got 710.
Well, I got one.
Yes.
Oh,
that gets you nothing.
I know it does.
Mega Millions tonight is worth $104 million. Mississippi Match 5 is also tonight. You can play that. It is worth $60,000, the estimated jackpot. And Powerball is tomorrow night. It is the highest so far. It's $137 million. Got that out of the way. Give me an update on what the lingo is and the narrative as far as the Senate's concerned. You guys have been meeting. What's an update as far as the narrative as far as Medicaid expansion?
Well, I'd say we're going to be having some hearings starting in September, and we'll have I'll be bringing in folks from the national perspective, people who are agencies and groups who are for expansion and who have supported it, and then those that are a little bit more cautious and recommend against expansion. And then in addition to that, would like to have a couple of the other states, Indiana and Arkansas are two in particular, I'd like to hear a little bit more from.
Is it aggravating and confusing to you, even as chairman, to one day you sit down and you say, well, this is doable, and the next day somebody says, no, it's not doable, and you just get different figures? Nobody gives you the black and white of it?
Well, everybody has their different perspective, Paul.
But they're all politically tinged one way or the other.
They tend to be, and I am not for traditional expansion. I would like for us to take a look and see how we can help some of these individuals who are kind of on the bubble. And I think there are probably some programs out there. It most likely would require us to get a waiver, and I think we just need to sit down, take a look, and see what options are out there.
Do we have the flexibility to take advantage of those federal dollars at the same rate if we do our own customized expansion, even though you don't want to call it expansion?
That I don't know. That'd be a Drew question.
Yeah. We did have the story yesterday. The hospitals in the state, the rural hospitals, just got $13 million in federal funding. The U.S. Department of Health and Human Services gave $12,918,800 through the Small Rural Hospital Improvement Program. 50 small rural hospitals in Mississippi, according to a release from the White House, and they can use that money to expand access to testing in rural areas, or I guess whatever they want to. The State Department of Health on Monday announced, well, that was something else. But have you heard that, and how does that play into it?
Well, I knew they were getting some additional funds from the CARES Act, and that's good for the hospitals. It's not good for us taxpayers, though, but it is good for the hospitals to have that income coming in.
One of the things that people ask me is there any review, we're talking about from the state level, expanding and putting that cost on the backs of the taxpayers of the state? That's where the money comes from. Washington doesn't have a money tree other than the taxpayers. But the major force behind this is the hospitals in the state of Mississippi saying, we need this, we have to have this. Is there any review from the state part on down, checks and balances, or at least a peer review of how these hospitals are doing as far as the management of their own money?
Well, I think for the most part, people, they're their own business, and so the state really doesn't get into running their individual business. But from the state standpoint, from the general fund, we put in about almost $1 billion, and then we get about I'd say roughly $250,000 from the hospital assessment component. So they do put in I think their share.
Yeah. Well, I guess my question is this: before you get this money and you're asking us to pay more in taxes for that, are you running exactly like you're supposed to, or are there some inefficiencies or some things going on as far as your operation? Before we give you that money, you got to get your ship in shape.
Well, I think that's certainly a good consideration. But again, government doesn't get into running or the overseeing of the management of private businesses. From my personal standpoint, being a ex-hospital person, I think some of the rural hospitals need to repurpose themselves. Mm-hmm. You just can't keep, so putting myself back in that chair as a CEO, heck yes, I want expansion. I want to minimize the losses that I've got. But at the same time, do you have the population? Do you have the volume coming to you in a rural area? To start with, how should I be providing services to that community?
Every small community that has a hospital wants to keep it because of obvious reasons. But if the community can't support it, then why should a community or taxpayers in another region support them? I mean, I use the example sometimes, and Kevin Blackwell, Senator Blackwell's my guest, of movie theaters. There's a lot of small communities that I grew up in had movie theaters, but they're not affordable now. I mean, or non-survivable. They can't survive in a market today. It's because the market's changed, culture's changed.
That's exactly right. Environment changes, and you saw back in the 60s when Hill Burton first came in, you had this proliferation of rural hospitals, and Mississippi was one of those states that took full advantage of it. I think, and to the point maybe they had more rural hospital development under that than any other state.
Is the CON controversy going to be settled in the next session?
I believe Senator Bryan is going to be holding some hearings and taking a look at the CON process. I believe we need it. It needs to be reformed, drastically reformed.
What would you like to see with your background in hospitals?
Well, first of all, a hospital needs to be a hospital. And so if I've got a hospital and my emergency room is full and I, along with the executive team and the board, decide that we need to expand and spend several $1 million doing so, another hospital shouldn't be able to hold me up for 2 years because they don't want to see that expansion. And that's sort of what we have and how that CON process is used, is I'm going to use it to prevent you from expanding.
Been fighting against that for a long time, but it's just counterproductive to a better service and competition.
It's that. And additionally, just the state health plan. I think the 2001 health plan has data from 2018 and maybe even 16 in it. Well, if you have to use that document to provide or support a need, it's already outdated.
I wish we had more time, but we're almost out already. It's going to be a short segment with you. But before you leave, what would your ideal workable plan as far as the expansion be, even if you're not going to call it expansion?
I'd like to see something where maybe we can provide an insurance supplement, or individual could have an opportunity to purchase for a very low premium some sort of supplement. I think we ought to take. By
the way, this is where we're talking about it. 138.
At 138, yes, sir.
At 138 to how high?
That I'd have to take a look at, but certainly up to the 138.
We're talking about percent above poverty, as far as 138% above poverty.
That's correct. But then, when you do that, you have the consideration of what companies are already providing coverage, and they see that, all right, this is an opportunity for me to save some money, save expenses.
Sure, they'll drop it.
Let these guys get on the government dime. I think the expansion or taking a look at association health plans would make sense. Those are plans in which small employers, self-employed, can pool together and purchase insurance, just like a larger company could.
Couldn't you write in there if you've been without insurance for a set amount of years or something like that?
We could propose anything.
Are these discussions going on starting in September, of that?
They'll be starting in September, yes, sir.
Yeah. Anything else real quick that you want to mention?
No, just down here today to meet with some of the Senate staff to try to get the final works going toward the medical cannabis bill.
Wanted to talk about that, too. We didn't have a chance. Can you hang on for a second? I got one quick second. I do want to touch base on that, though, on the cannabis bill. And it's a short segment, but I want to hold you over for a second or two. Kevin Blackwell, Senator District 19 to Little Marshall counties. We only need an hour with you, man. Come on. Today, a couple of things that you're going to be handling. We talked about some other things, but you have a couple of things on Medicaid, and one of them was, explain that to me.
We were talking off air about the chokehold language that the department has talked about, where it's limited.
Medicaid department.
Medicaid department, where it is frozen the payments for providers. That was not our intent in the legislature to do that. If anything, our desire was we did not want any reimbursement cut to providers and wanted to be notified of that. But anyway, with this language and now they're freezing payments, it provides an opportunity for us to come back in a special session and resolve that.
How long can you go without?
Well, it started July 1, and I'd like to, again, it wasn't our intent to freeze the payments to the providers.
So that could be taken care of along with maybe anything moving forward as far as medical marijuana.
Yes, sir.
Where are we on the medical marijuana now?
Well, I'm meeting today with Senate staff and also with the governor's staff to start putting the formation of the bill together. And then once we get that done, then we'll get agreement on the Senate side. This is from others that make sure it's what we want.
Senate side or House side?
The Senate side, before we go over to the House.
Do you know what the House bill is? Have you seen the House bill?
Not on medical marijuana?
Yeah.
I have not.
Okay. So you don't know how closely, when you fashion yours, you're not sure exactly what they have.
No, I don't know that they're drafting one. I'm working with Chairman Yancey on the House side now.
I don't think they're drafting a new one. They're the one that they had put forth earlier. Is that what they're working on?
No, sir. I'm not aware that they're actually working on a bill.
Oh, okay.
And you're talking about the 65A proposal?
Yeah.
No, sir. Not that I'm aware of.
What would you guys like to see? Would you like to see it mirror 65 as much as possible, 65A as much as possible?
Yes, sir. We're trying to look at it right now and try to get as close to 65 as we can because that is the provision that the majority of the people voted for.
You think you have enough people in there that would allow smoking, marijuana as well, for other than terminal patients?
I do. It was I'd mentioned before, it was a hurdle to get over. We've actually passed a bill 3 times out of the Senate this last session.
Would the Senate be in favor of giving the municipalities an opt-out?
I hope so. I believe it ought to be everybody's in, unless you want to opt out, and the opt-out should be through a referendum of the people. Because and I've got the statistics of the election results.
So they would have to have a local referendum.
Yes, sir.
What are we bannering around as far as the Senate, as far as the tax rate?
Right now, we're taking a look anywhere from about retaining the 7% tax, and the money going to the general fund.
But the money would go. It wouldn't be earmarked for a specific agency. It would go to the general fund.
That's correct.
Would you start a new agency in here as far as the Cannabis Association or Cannabis Agency, or would it run out of the Health Department, or how would you do that?
Well, personally, I'm not in favor of starting a whole new bureaucratic agency. I think it could be accomplished with we could put together an advisory committee if we wanted to do something. The way I see things, and again, this bill is just being drafted, so it's just conceptual. But I would have the Department of Ag oversee the growers and the processors, and then the Department of Health oversee the testing facilities and issuing of and the dispensaries and the issuing of the card holders.
Legal aspects from the Department of Public Safety?
Yes, sir.
Indoor or outdoor or both?
I would prefer indoor. We've seen and heard testimony, let's say from Oklahoma. They have, I think, over 2,000 growers, and a lot of it's outdoors. So they also have a lot of cartels.
2,000 growers or retail places?
I believe that I read it's 2,000 growers, cultivators. And so now you have a lot of it done outdoors, and you have a lot of the cartels now coming in and legally growing pot and then shipping it out of state.
So that's creativity. Now that's entrepreneurship gone wild, isn't it?
It's gone wild.
When has your office or you as chairman talked with the governor's office about the possibility of a special session in August?
I have, and again, that's all contingent upon the Senate coming up and agreeing on a bill, and then getting with the House and making sure they're on board.
Nobody's talking about the initiative process right now. I mean, that's one of the things that we understand can wait a while.
Yes, sir. I believe we'll take that up in January.
And So if we do have a special session somewhere, possibly by the time this is done, middle to late August.
That time frame is good.